Hi, my name is Dr. Edalati. I'm the medical director for Elumind Centres for Brain Excellence. Thank you for watching this, and we're going to talk about ADHD today.
What are these sneaky little signs of ADHD that most people miss, especially when they don't fit the usual hyperactive image?
So that's a great question. Most people really look at ADHD as some kid bouncing off the walls, but we all know that this is not oftentimes the case. Most of the time, what we have are inattentive individuals who basically have a lot of internalized signs that oftentimes are overlooked. So what are some of these signs? For example, time naivety. Oftentimes, individuals have a difficult time estimating how much time they need to get a task done or to be at a place. They're not trying to be rude or anything, but they just have a distorted internal thought. The other one is difficulties with emotional regulation. So they overreact to these very small slights or these stimulations, and they have a hard time calming down. And oftentimes, individuals with ADHD have mood shifts, which is really not explained by any other diagnosis. The other one is executive malfunction, where individuals have a difficult time starting tasks. So they basically drag their feet and they don't start, or they have a difficult time completing tasks and making decisions about how to proceed. One other one that we see is hyperfocus or laser focus. So, I have parents coming to me and saying, well, my kid can focus on video games forever. And of course, that's oftentimes the situation where certain tasks the individual can focus very well on, but then the other tasks get sacrificed in the process. Rejection sensitivity, this is something I commonly see. So, someone is very prone to having sensitivity to criticism or sometimes just perceiving rejection. And of course, if they have difficulty with emotional regulation, this becomes a problem because they react quite significantly to something that they perceive as rejection. Finally, something that I think a lot of people can relate to is poor working memory or what we call short term memory. This is when somebody walks into an office and they don't remember why they walked to the office in the first place, or they leave their phone or their keys around somewhere and forget where they left it. This is commonly a problem with short-term memory, and we see these symptoms kind of being sneaky. People don't necessarily always know they exist, but they are there in the background.
So let's say someone starts connecting the dots and thinks this might be me. What's the first move they should make here in BC to get answers?
Well, first, they see your family doctor. And I know it's a challenge. A lot of people don't have a family doctor, but you're in a walk-in clinic to see a doctor who can refer you to a specialist, either a psychiatrist or a psychologist or a pediatrician if this is the situation with a child. And this will give you an opportunity to get a formal diagnosis, which oftentimes would then help in terms of figuring out what kind of treatments would be helpful. Kids also would have access to psychoeducational assessment through school system. And usually this is done in grade school, but sometimes later on, if parents choose to, they can have this done privately through a psychologist who specializes in psychoeducational assessments. The second step I would consider is looking at private options. If wait times are too long, because ADHD, of course, causes a lot of havoc in a person's life. So waiting that long might actually cost an individual a lot of friendships or jobs or things that they might hold dear. So clinics like Elumind, they would offer QEG informed assessments and also what we call therapeutic assessments or consultations with a mental health professional, which would then allow the person to get much faster access for diagnosis than the public system. Finally, keeping track of your symptoms and your progress. So whether you're getting started, keeping track of those symptoms, or whether you're being through a treatment and keeping track of your progress is very important. This basically allows the clinicians to know where you're at. And some of the things I would certainly keep track of is whether you have attention lapses or You have difficulty with task completions or task initiation for that matter. Emotional patterns that you experience throughout the day or with respect to any kind of stimulus. So if you're, again, overreacting to situations, I would keep track of that. Any patterns of procrastination would be something that I would also keep track of. And these are things that would help with both clinical interviews, but also it would allow the clinicians to fine tune the treatments. So at clinics like Elumind, they have their own ADHD portal, and this can be basically helped through these portals. So some of these task tracking can be done through the portal for ADHD clients that come to Elumind. Finally, I would rule out any other conditions that resemble ADHD. For example, nutritional deficiencies such as iron, vitamin D deficiency, vitamin B deficiency, especially vitamin B3 deficiency, can cause lack of neurotransmitters or chemicals that we need for managing our attention and regulating our emotions. Finally, sleep apnea, trauma, anxiety, or depression can sometimes resemble ADHD. One note is that people who have mood shifts, they oftentimes might think that they have bipolar as a condition. Now, people with bipolar have many other symptoms along with mood reactivity or mood overreactivity. They share that area of the brain with bipolar and ADHD, but they certainly do not have the same symptoms.
Life is overwhelming for pretty much everyone these days. But how do you tell the difference between regular stress and something deeper like ADHD?
That's an excellent question because stress can actually impact attention. And oftentimes people think that they have ADHD when they cannot focus, even though the trigger or the cause is actually stress. Now, what's the difference between stress and ADHD? Stress is often situational with identifiable triggers. So, what you would see is someone who's writing an exam or is bound by a deadline, they would have difficulty with their attention. ADHD is chronic and it cuts across all environments, whether it's school, whether it's work, whether it's home. So it's pervasive across all these environments, as opposed to when we see a stress situation where it's really bound to that particular environment. ADHD persists since childhood. Oftentimes it starts in childhood, and even if it was missed, the adult client would actually experience the symptoms. And if you've always struggled with focus disorganization or emotional reactivity, that's a red flag. With stress, we only see that in bursts or in some episodes. Stress, of course, improves with rest or vacation. ADHD doesn't. When somebody has ADHD, in fact, when they go away, what happens is with all that unstructured time, things can actually be more difficult for them and their ADHD symptoms can worsen. So also impairment is the key that we see in ADHD, but we don't see necessarily in situational stress. ADHD oftentimes leads to functional impairment, so missed deadline, job loss, failed relationships, academic performance issues, etc. Whereas with stress, once the stressor is removed and the individual calms down, they can rebound of their function.
Once someone gets a diagnosis, medication isn't the only path. What natural or brain friendly strategies actually make a difference and have the science to back them up?
Wonderful question. Absolutely, there's so many integrated ways of looking at non-pharmacological, non-medication treatments for ADHD. Of course, medications and methods that are not medication are complementary. So we would advise to follow the integrative model of Elumind, which is roads, cars, and drivers, which means that we look at the brain's pathways, we look at neurotransmitters in the brain, and finally look at behavioral stuff, and we call that the driving skills, right? So what we want to do is we look at some non-pharmacological evidence-based strategies, and some of these you may have heard of. For example, neurofeedback. Neurofeedback is now being talked about everywhere because it is a very powerful and backed by evidence treatment that trains the brain. And of course, what we want to do is get rid of some of the issues that we see in ADHD. For example, neurofeedback can regulate attention. It can help with impulse control or reduce reactivity of mood, or overreactivity, I should say. It can also help with executive functioning and decision making, some of the things that people have trouble with when they have ADHD. And again, these are backed by randomized control trials. So these are really high-end clinical trials that we've seen that have all been validated by medical science. The other treatment could be cognitive behavior therapy, or CBT. So CBT is basically tailored for adult ADHD, and it helps with people who procrastinate or avoid tasks completion, or sometimes they have impulsive behaviors, and some CBT can really help with that. Along with that, we have life coaching, and life coaching, most people have heard about, can help with figuring out time management and organizational behavior. Also, it can help with regulating some of that impulse control again that we talked about. Exercise is a wonderful and very, very cheap tool. So regular aerobic exercise can boost dopamine and norepinephrine, and these can basically mimic the effects of a stimulant medication. Omega-3 fatty acids, I referred to also earlier, to B3 or B complex, B vitamins specifically, can be very helpful in helping out with attention regulation issues or impulse control. So I would highly recommend that. And there's many meta-analysis or very high-end, again, studies that show significant symptom reduction, especially with EPA, which is a type of basically omega-3. Mindfulness meditation is another tool we use that can be very helpful. Again, this tool is the origins come from the East, and John Kabat-Zinn brought it to the West. It helps improving attention regulation and emotional control, and also helps with awareness of situations that the individual is in. As we know, inattention and lack of awareness oftentimes are symptoms of ADHD, so mindfulness can be very helpful in that. Sleep hygiene and sleep cycle correction. So sleep is a very critical part of our brain's well-being in general, and when we have regular sleep, it allows hormones that typically fall in a night and day cycle to be released when they're supposed to be released, as well as it allows the brain to get rid of some waste at nighttime. So very, very important part of our ADHD management. Functional executive coaching is one that I would recommend for people who are kind of on the higher end, executives, professionals who have difficulty with attention and executive functioning. And so some executive coaches go beyond just life coaching, and they can help with tools that they would provide for executive function.
So the healthcare system can be a maze. What makes Elumind's approach stand out for BC residents trying to get the real support for ADHD?
So, yes, absolutely. I concur with that. It's tough for people these days to get mental health support. One of the things that we do at Elumind is an integrative psychiatry model, which talks about brain first and also treats every individual as unique. So we look at basically client-centered care. And things that we do at Elumind, neurophysiological testing, such as a QEEG brain map, or simply called brain mapping. Brain map activity patterns are looked at, again, when we do this, and this allows us to help tailor non-pharmacological or non-drug interactions, but also it allows us to see which medications would be helpful in someone who struggles with ADHD, and kind of combine the non-pharmacological and pharmacological interventions together. We also look at multimodal support at Elumind. So we combine psychiatry with brain treatments such as neurofeedback. And then we bring psychotherapy, which is talk therapy, and help somebody, for example, receive CBT or cognitive behavioral therapy that I talked about earlier. We help with functional nutrition, specifically nutrition for ADHD, and how we can manage that. And of course, mindfulness is one of the things that we oftentimes encourage as well. So our message is basically that no one size fits all. So we need to have treatment that is stratified by the type of ADHD that we encounter. So some people are over focused or hyper focused. Some people have kind of more limbic or emotional issues, and some people have very classic presentations. But again, all of these have to follow neuroscience. The brain is a very precious organ, and so we want to make sure that we use neuroscience to define the diagnosis or the subtype of diagnosis, and then define the tailored approach to treatment. So this allows clients to feel empowered, and this gives them a path that's clear and something that they can be collaborating in, and allows them to understand that their brain patterns actually are involved in the decisions that they make. And so this will help them regulate better and improve their attention. Finally, we look at continuity. So when you go to get a medication, usually, you get a medication and you're on your own and off you go. But when we work at Elumind with someone who's got ADHD, it starts out with a full assessment. Then we go and look at treatment options and follow up. Is, of course, one of the biggest things, because you want to make sure that there's ongoing optimization of the brain, because life happens, right? And so we want to make sure that when we start a journey and we start the treatments, we continue that journey and help the individual continue to improve in life.
Homework battles at home can feel like a war zone. What actually works for helping kids with ADHD stay focused and motivated without turning every evening into a chaos?
I think a lot of parents can really relate to that. It's I've seen the screens, and even in my office, sometimes I see people going at it. Right? It's absolutely amazing how uh, exhausting it is for parents and the kids. Right? It's both ways. So some of the things that can be done is, for example, start with things like timers, right? And oftentimes kids love timers, right? So they may turn it into a race, and one of the games is just beat the clock games, trying to get this done. Um, we call that sometimes Pomodoro style, and this can basically harness this urgency-driven motivation, right? Body doubling, so parent can basically sit next to the child and do their work, and just that calm presence can really help the child settle down and encourage the task initiation. So encourage the child to actually start with something, right? And every time they get a little antsy, maybe the parent can help them settle down, maybe give them a little break. But that presence, that doubling presence, is very helpful. The other thing is externalizing everything. So using whiteboards, color-coded charts, visual checklists, things like that can be very, very powerful. In ADHD, we know that when something is out of sight, it is out of mind, right? So if we use these visual tools, the child can really benefit from seeing it visually and being engaged with that. So the other thing is using rewards, right? Parents oftentimes, and this is a big struggle for me trying to explain this to the parent, because they want to get jobs done, right? And so there's like, okay, you get this done, then I'm going to reward you. A child who has ADHD is not going to be able to wait that long, right? And they get very discouraged, and they start to have problems with their attention very quickly. So what we call this is a reward immediacy, right? So offer the instant reinforcement, not when you're done with everything. And what you will see is that the child then, through what we call operant learning, or reward conditioning, learns to actually do better every time with respect to task completion. So the duration of time it takes for a child to get going reduces as they get rewarded, right? The other thing is breaking down the task, right? One tiny task at a time, one page at a time, one problem at a time, one step at a time. So don't give a massive project to someone who has problems uh, to get going, basically. So if somebody has problems going and you give them a massive project, they're overwhelmed and their attention just wanders off. So you want to really break it down and avoid the ADHD brain to freeze with the complexity of the task at hand. Avoid shaming children. I don't understand why some people still do this. It's not helpful. One of the issues we have is self-esteem in kids because they've been shamed so much. Why didn't you finish this? That doesn't help a child. Instead, say, let's figure it out and see what we can do to make it fun today. And that is something that children will respond to.
Let's talk procrastination. It hits differently with ADHD. What neuroscience-backed hacks can actually help when the traditional productivity tips just don't cut it?
So, procrastination ADHD is typically caused by certain uh, neurotransmitter, and it's called dopamine. And most of the time, people mistaken this as laziness. So often I have people with ADHD being labeled as lazy, which is absolutely the worst thing to do because it really undermines the actual cause of it, which is a low dopaminergic activity or under arousal. So how can we change that? First of all, you can start with having novelty triggered routines. So change the scenery, change the tools that you're using for a given task, or even use different fonts to spike up dopamine levels. The other thing that you could do is called the just one thing technique. Basically, commit to only 2 minutes of a task. Once started, basically the person's inertia to continue helps with continuing that task. Make the task a game. So we call that gamifying the task. Add point system to this task, reward streaks, or even have some digital tracking that would help identify all the progress that's made in this completion of the task, right? Those are some of the low-level dopamine activity levels. You can also do other things such as high stimulation environment. So when somebody has basically very high stimulation environment around them, interestingly, they can focus better. You can see all these guys in a coffee shop, right? And music in the background, and it's a surprise to everybody, right? So I'm thinking, how can you work in an environment like that? It's just so much noise around. But to someone with ADHD, a high stimulation environment would actually be more helpful, especially if this involves binaural beats or what we call brown noises. Using deadlines, right? So externally imposed deadlines and having a coach to keep the individual accountable publicly, and maybe sometimes even coworkers can do that. This creates urgency, and for someone with ADHD, this can really help. Another favorite topic of mine is habits and how habits basically can help an individual with ADHD really excel, because habits are also based on dopamine, and these are reward pathways in the brain that are enhanced, whether it's a good habit or bad habit. Not, it doesn't matter really. And our goal is to really help the individual get rid of the bad habits and enhance the ones that are helpful for that individual. Now, how do we do that? So habits have a formula. The first step in a habit is a cue or a trigger. So what happens is, I have a bag of cookies in front of me, right? That's a visual cue or a visual trigger. And of course, the next step is my craving. So my craving goes up when I see the bag of cookies, and I'm thinking, oh, should I have a cookie? Should I have a cookie? And this craving continues to go up until I get a response out of it. So I go for the cookie. And once I go for the cookie, that's what happens. I have all those dopamine pathways light up. because of the taste of that cookie. And so I get reinforced, and guess what? Next time, my craving goes up much faster with the same cue or trigger. So any habit really has those four components. So we have cue or trigger, we have the craving, and we have the response, and of course, the reward. And so what we want to do is make sure that good habits are rewarded and poor habits are discouraged.